Namaste. I am Professor Dr. G.G. Gangadharan, practicing at Bhadrappa, Bengaluru, with 40 years of experience in the clinical Ayurveda medicine. Vasti is the last word of Ayurvedic treatment. And in olden times, great old Vaidyas say, if a Vaidya knows which oil to apply on head and what Vasti to be given, he is the perfect physician, because these are the two things which is very difficult to get masterly on. So Vasti is a kind of rejuvenating and cleansing kind of rectal insertion of fluids in a regulated manner for a specific period of time. And normally there are three durations of Vasti: Yoga Vasti for 8 days, Kalavasti 15 days, and Karmavasti 30 days. These are divided in such a way that when we give Vasti, the course is like that: first you actuate, then you cleanse, then you actuate, then you cleanse. Actuation or making unctuous things in the body is given by ghee or oil medicated items. After that we give decoctions. These are also known as big Vasti and small Vasti. The reason is that small Vasti means small quantity, big Vasti means larger quantity. So larger quantity Vastis are given 750 ml, that is almost 3/4 of a liter, is given as a rectal infusion. And Snigdha Vasti or the Matra Vasti or the Sneha Vasti, we give 100 ml to 200 ml, maybe ghee, maybe vasa, we say manja, or even if oil. This is done in a rhythmic way. In Yoga Vasti there are 5 Sneha Vastis and 3 Kashaya Vastis. And all the Vaidyas know, 15 also we are divided. There is a pattern of giving Vastis. So these Vastis are done in almost all chronic metabolic disorders which are due to lifestyle changes and lifestyle aberrations. So Vasti, if you use Vastis, different dravyams are used. Milk decoctions are used, water decoctions are used, and is used along with other dravyas like ghee, kalkam of specific kind of decoctions or plants, and also other materials. And even mixing of Vasti Dravya itself is an art and science, how to mix one after another and how to make the consistency of Vasti same. So it should never irritate the colon, and the temperature should be very, very normal, should not go overheated or less heated. If less heated, it will give a sthambanam, it will not come out. Overheated, it will give it kind of irritate the colon. If there are particles are present, it will irritate the colon. So, we will not do the purpose. So, we have to, Vasti is a most expert required treatment procedure in Ayurveda, done by very serious and very senior physicians in a proper way. Vasti is done always after doing many other pacification medicines are not effective. When this is the only way to heal the condition, we use Vastis. Something that one has to care that Vasti should come out within 30 to 40 minutes. It should not stay more than that. Then we should do methods to make sure it comes out quickly. Otherwise, it can hit the diaphragm. It can bring in complication of cardiac suspension, etc., etc. That shouldn't be allowed. And also, should not come out immediately. If it comes out immediately, the whole purpose of Vasti is failed. And we have seen today, this day, that people give Vasti, it comes immediately out. Then it is of no use. And it is a very expensive procedure. It is not a simple procedure. It is a complicated procedure. So Vasti has to be done in a very well regulated way. And Vasti is the Chigilsartham iti kadyade. The all treatment of Ayurveda's half belong to Vasti. Vasti is equivalent to all other treatments told in Ayurveda. And there are conditions like obesity, when there is a condition of chronic constipation. Then there is a single Vasti also being done as a Virejana Vasti. Virejana Vasti, as the name indicates, which is cleansing and clearing the bowel. So people with chronic constipation, Virejana Vasti may be very useful. And if there is a high obesity, we can give Virejana Vasti with Varnadi Ganam kind of thing, which are reducing effect in the body. This is done as a single Vasti in a single day, in a repeated way, once in a week, once in fortnight. So slowly the fat metabolism in the body get corrected, the obese person get lean, and constipation start decreasing, and body get more actuated and more regulated. Basti mainly is the work to bring back the lost balance of the gut microbiome, which is one of the biggest new area, gray area of science, where we don't know what are the gut microbiome activity, even it is told as a second brain because of the kind of bacteria that works, and it affects the body's metabolic process.